Hi, this is Paul Angelchik. I'm a plastic surgeon in Glendale, Arizona, and I'm here to give you some patient pearls about facelift surgery. We talk about pearls in medicine and surgery. We're talking about key pieces of information that give us insight into a topic that's important. So, what is a facelift? When do we do facelifts? If you're a patient who's thinking about a facelift, what do you need to know? So, a facelift operation, classically defined, is an operation used to rejuvenate the cheek, jawline, and the neck. So it treats this area and it treats the neck. When we add other procedures in there to take care of the eyelids, take care of the forehead, other areas around the mouth, etc., we're adding things into facial rejuvenation, but classically it's not part of a facelift procedure, so I'm not going to discuss those right now, other than to say we often combine facelift surgery with other procedures at the same time for patients. So the facelift operation, as it's done currently, typically is going to lift and tighten the skin and a layer underneath it called the superficial musculoaponeurotic system, or SMAS layer. That's the layer of tissue that has the muscles of facial expression in it. Tissues on the head and neck are arranged in layers, so we're taking the top two layers and we're going to tighten them. When we do a facelift, first we lift up a flap of skin. So in the cheek, that's going to be, this area here is going to be elevated. Skin and fat is elevated off of the deeper muscle layer. And in the neck, if we are doing the neck in someone who needs it, same thing, we're going to lift skin and fat off of the deeper layers all the way through. And that's done through an incision that starts at the hairline, comes through across the sideburn toward the inside of the ear, down to the earlobe where the ear meets the face, and then in the crease between the ear and the mastoid bone, and if necessary, back at the hairline or in the hairline on the neck. Once we've lifted up the skin, then we're going to tighten up the deeper layer. The deeper layer can be tightened by incising it, cutting into it, lifting up a flap just like we did on the skin, taking care to avoid injury to the facial nerve if we're doing that, or removing part of that deeper layer and suturing the remnants together for tightening in that fashion. And it can also be done by folding the tissue upon itself, which is a technique called plication. Plication can be done in different ways. One of the techniques I use frequently is called a minimal access cranial suspension facelift, or MAX facelift. This is a technique that was developed in Belgium, and it uses suspension sutures in a purse string fashion to lift the deeper layers of the facial tissues and creating a sling effect, which also helps to tighten the neck. But every patient is different, and the technique that you choose will depend upon the patient's anatomy and what's going to be best for that patient. The reason that there are multiple techniques, and this is true for almost any area in surgery, when you have multiple techniques, it means that one technique is not necessarily absolutely the best, that different techniques work in different settings. So the MAX technique, I like it because it looks very natural. People look like themselves. They just look refreshed and younger. They don't look like they came out of a wind tunnel like some facelift patients do, because the vector of lifting corresponds with the natural vectors of reversing the aging process. The other part about aging that we need to understand is it's not just things falling down because of the effects of gravity. It's also the effects of photoaging, the damage from the sun and the environment on our skin, and changes in the structure of the skin, which make it less elastic, less strong, changes in volume in the fat compartments within the face, changes in bone volume as well happen. All of that contributes to aging. So a facelift is often combined with other things because by itself, a facelift is not going to reverse all those different factors. When we do the facelift surgery, it's done as under general anesthesia. It's done at a surgery center with a board-certified anesthesiologist. Depending on what we're doing that day, it could take 3 hours to 5.5 hours to do the facelift, and then we may add adjunctive procedures onto that in some patients. Post-operatively, the patients are going to have drains in my practice for 2 days, and they're wrapped up in a big fluffy dressing for 2 days. If I do their neck, I keep them overnight to to keep an eye on them and make sure there's no problems. If we don't do a neck dissection, I'll let the patient go home. And we see everybody the next day, whether they're in an overnight facility or they come to the office. Typically with facelifts, there's not a lot of pain. You will feel some tightness. We ask you to do a softer diet for a couple weeks just because it's tight to do a lot of hard chewing. You'll be on antibiotics for a period of time. Pain medicine is needed, something for nausea. Once the dressings come off, you can shower and you'll do some suture line care with antibiotic ointment. Sutures usually come out about 6 days after surgery. After 2 weeks, during which time we ask you to keep your head up and not get your heart rate and blood pressure up, after 2 weeks you can basically go back to normal types of activities. For socializing and work activities where you have to be in front of clients, 2 weeks at a minimum, typically 3 weeks is best, but 2 weeks at a minimum before you'll feel comfortable being in front of people. At 6 weeks you won't look like you just had surgery anymore. Now I know there are patients who have the idea that they can go to a doctor and have a facelift in an hour at lunch and then go back to work the next day and everything looks hunky-dory. If that's the case, I've never seen it, and I've seen a lot of facelifts. If it sounds too good to be true in surgery, like anything else, it typically is. But the facelift operation, if done properly, will make you look nice. It won't make you look pulled too tight. If you need something else, because the facelift can't solve every problem, then you need to have that. If you need volume in your face, you need to have that. Redraping skin and making it tight over a face which has lost a lot of fat volume isn't going to look as good. If you have skin that has a lot of sun damage and damage from photoaging, you need to do good skin care. Anybody who wants to do anything on their face needs good skin care as a first step anyway. So those things are important. The facelift operation, when done properly, makes a nice difference that lasts for many years. You won't look the same 20 years later after you've had it than you do a year after you've had it, but you'll look better 20 years afterwards than if you never had it at all, because we're setting the clock back. We're not stopping the clock from ticking.